This is part 2 of the play, A Tale of Two Kidney Beans, and Dr. Walter Kempner by me, Pete Rogers. So now we have the character, the mother, Molly, and the son, Ronan. It's 5 years later since the original kidney transplant of the son, Ronan, to the mother, Molly. And they're meeting at the family home, and Ronan says, the mother says, "How's it going, Ronan?" He says, "I'm making good money at my job, but I feel kind of sluggish. I don't know why. My energy isn't what it used to be. I'm strong, but I get tired fast." And the mother, "Well, I know that giving me the kidney messed up your bodybuilding career. I'm sorry about that." Ronan, "It's okay, Mom. I don't think I was good enough to be a professional bodybuilder. I still like lifting weights as a hobby." Molly, "I got another hobby for you. Why don't you get married and give me a grandchild? You're always working, and your sister's always studying. I don't know if I'm ever going to get a grandchild." And sister Mary's over there as well. She says, "Oh, Mom, Harold and me, we want to have a baby, but I just want to start my fellowship first. And by the way, I've decided for certain now, I'm going to become a nephrologist. I want to see if I can learn how to help you." Okay. And the mom, "Oh, Molly, that is so nice. Thank you. Mary, it's the least I could do for you. Ronan did more for you than I could ever do." And the mom, "Ronan, it's not like you to be feeling tired. Also, I don't want to be mean, but you gained a lot of weight." Ronan, "Yeah, I know. I'm working long hours. I'm not getting enough sleep. I'm kind of stressed out." And Mary says, "You look exhausted. You look like you're aging at an accelerated rate. You should go to the doctor and get some blood tests." Okay, so Ronan goes to the doctor. He goes to Dr. Leach. And of course, the name Leach is a joke of a name for an internal medicine doctor because they're always drawing more blood tests. Okay, nurse checks his vital signs and they weigh him. And then Dr. Leach comes into the room and says, "Hi, Ronan." Ronan says, "Hi." And Dr. Leach says, "Your blood pressure is very high, 170 over 100. That's quite high for a 25-year-old. Ronan, what's it supposed to be?" Dr. Leach, "About 120 or lower. We're going to have to put you on 2 medicines for that blood pressure." Okay. Systolic is the top number, diastolic is the lower number. Okay. So Ronan's like, "Okay." And Dr. Leach says, "Also, you're about 100 pounds overweight from your ideal body weight." Ronan, "Yeah, I know. I'm trying to eat better. I've been doing the paleo-keto diet." Dr. Leach, "That's okay, but the Mediterranean diet is better. The Mediterranean diet is the best diet." Ronan, what is the Mediterranean diet?" Dr. Leach, "It's things like fish and chicken and olive oil and nuts and seeds and avocado and coffee and tea, omega-3s, stuff like that, soy and flax." Ronan, "Okay, I'll try it." Dr. Leach, "You said you were feeling more tired than usual." Ronan, "Yeah, sometimes I fall asleep in the middle of the day." Dr. Leach, "Well, it could be, sleep deprivation, but it could be sleep apnea. You might have a low thyroid." Ronan, "I think it's just because I work too much and I'm not sleeping enough." Dr. Leach, "That might be it, but we're going to send you for a sleep study with a sleep doctor. They're also lung doctors, pulmonologists." Ronan, "Okay." Dr. Leach, "You do seem to be physically strong." Ronan, "Yeah, thanks. I still lift weights a lot. I was an amateur bodybuilder." Dr. Leach, "I hope you're not taking anabolic steroids." Ronan, "No way. Too expensive and too much trouble. You have to cycle them. They make your testicles shrink. I do take a creatine as a supplement, and I also take a lot of protein powder. All weightlifters do." Dr. Leach, "We need some blood tests. We'll have the blood draw lady come pull a couple tubes from you, and we'll check your thyroid function, liver function, kidneys, hemoglobin A1C for diabetes, etc. Then come back tomorrow, and we'll go over the results." Okay, so the blood draw lady draws the labs, and then the next day, Dr. Leach and Ronan talk. And Dr. Leach says, "We have a problem." Ronan, "What's the matter?" He says, "Your liver enzymes are elevated." That's almost always fatty liver, which is like diabetes of the liver. We'll get an ultrasound to confirm the fatty liver. Ronan, "Okay." And he says, "People with fatty liver often have diabetes." Yep. And Dr. Leach says, "You have diabetes. Your fasting blood glucose is 150. It's supposed to be less than 100. Ideally, less than 90. Your hemoglobin A1C is 10. It's supposed to be less than 5.5. Ideally, 5.2 or less. A level of 10 indicates poorly controlled diabetes. We got to put you on medications for that." Ronan, "Oh, great." Dr. Leach, "And there's one more thing, and it's the most important thing. You're in kidney failure. You're in stage 3A of kidney failure. Your kidney filtration rate is called glomerular filtration rate. We usually just call it GFR, and for someone your age, it should be around 100. Yours is only 45. And Ronan's like, well, I did donate a kidney for my mom, so I only have one kidney. Dr. Leach, even after donating a kidney, a GFR of 45 is too low. You're in moderate kidney failure. After you donate a kidney, you should get some compensatory hypertrophy of the remaining kidney, and we're not seeing that in your lab results here. If your GFR goes below 15, we're going to have to put you on dialysis. Ronan, dialysis? I'm too young for that. Dr. Leach, we need to send you to a kidney doctor, a nephrologist. Ronan, well, I know one, Dr. Marshall Waters. She's my mom's kidney doctor. She's nice. I'll go to her. Dr. Leach, okay. So Ronan goes to the office of Dr. Marshall Waters. She says, hi, Ronan. Ronan says, hi. And she says, your GFR is 45. When it gets below 15, you got to go on dialysis. Ronan, I don't want that. Dr. Waters, here's the stages of kidney failure. Kidney disease, usually called chronic kidney disease, CKD. And basically, a normal GFR is like 90 to 100. Stage 1's mild, but stage 2 is when you're about 60 to 89. Okay, as long as you're over 60, you're in pretty good shape. Stage 3A is like 45 to 60. Stage 3B is 30 to 44. And man, you don't want to get below 15, then you go on dialysis, okay? So the lower the GFR, the sicker the patient is. And you can be relatively asymptomatic. When you start getting below 30, you become more at risk for being unable to handle potassium. And like Dr. McDougall, for example, would give his patients more starch in that setting compared to fruits because they got less potassium. But when you're healthy, you want the potassium, okay? We also, Dr. Marshall Waters says, we also look at albumin levels because that's another indicator of how the kidney is doing. When you start losing albumin, it's a blood protein, and when you start losing that in the urine, that's a sign of proteinuria and higher risk for more accelerated continued failure of the kidney. And this is called a heat map of the kidneys. So basically it's a combination of looking at the GFR and whether or not there's protein in the urine or how much albumin protein there is in urine. Albumin is the most common blood protein. It's about 69 kilodaltons. And it's the main one measured in proteinuria. So if you've also got proteinuria on top of having a low GFR, you're at high risk for rapid progression of kidney failure. It's going to be more difficult to reverse. Okay, but the good news, Dr. Waters says, is Ronan, you don't have any significant amount of albumin in your urine. And Ronan's like, finally, a little bit of good news. Is there anything I can do to slow down this kidney failure? And Dr. Waters says, well, you can try the Mediterranean diet. That might help a little bit. We'll also treat your diabetes and hypertension, and that might slow things down a little bit. When your GFR gets below 30, we'll decrease your intake of fruits, especially if it seems like you're having trouble handling your potassium. Ronan says, okay. And Dr. Marshall Waters says, let's see you back in 3 months to recheck your kidney function, and we'll see how things are going. Okay. So 3 months later, Ronan gets a blood test, GFR repeated, and he meets with Dr. Waters to discuss the results. And Dr. Waters says, your GFR is continuing to decrease. It's down to 40. Ronan, why'd that happen? I'm taking the blood pressure pills, I'm taking the diabetes pills, and I'm eating the Mediterranean diet. Dr. Waters says, I don't know. Unfortunately, when the kidney starts to fail, it often keeps getting worse no matter what we do. Ronan, are you serious? There's nothing I could do? If my kidneys keep getting worse at this rate, I'll only have about 2 years left before I'm on dialysis. Dr. Waters, I'm sorry. Okay, that's the end of part 2. I hope you found it helpful.